risks of living with an MPN?
Yeah, so I think that that's phrased wonderfully because I think while we certainly want to develop therapies that eradicate the disease, I think we understand that most of our patients are going to live with their MPN for a long period of time, and I think that's something that we need to be very thoughtful about in counseling patients and talking with patients is how can they best live with this disease, because I think it is something that oftentimes they're going to do. And so there's a few risks of living with a myeloproliferative neoplasm. I think primarily one of the risks is developing a thrombosis, right? And we understand that patients with myeloproliferative neoplasms are at an increased risk for cardiovascular events. And the one thing that I often talk is we certainly do a lot of things from an MPN side of things to try to minimize that. We may recommend antiplatelet therapy. We may recommend phlebotomies or venesection to try to keep hematocrit at a lower level to kind of keep the blood less thick, if you will. We may recommend medication, a cytoreductive medication, if you will, to reduce blood counts and prevent or reduce the risk for thrombosis from that side of things. But I also think we can't ignore the fact that there's other contributing factors to cardiovascular events. There's certainly other cardiovascular risk factors that can be minimized, and I certainly advise patients to try their best to minimize those cardiovascular risk factors, to live a healthy lifestyle, to consider everything when it comes to diet, exercise, managing other comorbidities, to reduce the risk and put themselves in the best position to avoid some of those cardiovascular risk factors from occurring. I think the other risk that we think about is the risk of disease progression, and that's a bit more of a challenging situation because I don't think we have great evidence that any specific intervention or any specific lifestyle modification definitely prevents progression of the disease. Certainly, we're having emerging data with some of our therapies, such as interferon or maybe even JAK inhibitors to some degree, that may be able to decrease that risk of progression or delay that risk of progression over time in a subset of patients who are able to tolerate longer term therapy. From a lifestyle modification type of thing, I know we understand that inflammation, kind of this generic thought of inflammation, certainly plays a role in disease initiation and progression. I don't think we have the data yet that knows how to exactly modify that or modulate that. I'd love to. I mean, personally, I would love to live a life without inflammation. I'm not sure if that's a feasible goal to live a life without inflammation, but I think it reinforces the need to make sure that other comorbidities that are ongoing be managed optimally, right? And try to reduce the impact that those may have. Beyond that, I think there's other smaller risks of living with an MPN that can emerge. Certainly, we think about other cardiovascular events. There's been work looking at risk of atrial fibrillation or arrhythmias, pulmonary hypertension, which can occur more frequently in these patients. And so we do have to think about good multidisciplinary care for our patients with myeloproliferative neoplasms. So I think it's important for our patients to stay engaged, not just with their hematologist, but also their primary care physician, right, to make sure that they're evaluating for other things that may be seen more frequently in MPNs.